is Barry Gardiner, MP. Barry's been a Labour MP for Brent North since 1997 and served as a government minister in 3 departments and as Shadow Secretary of State for Energy and Climate and Shadow Minister of the Environment. So it's a great pleasure to have you here, Barry, to give us your perspective on COVID-19, a golden opportunity to tackle air pollution. So over to you. And
great. Well, look, thanks very much. And as you can see, I'm taking full advantage of being outside. And I just want to say many thanks to Sophie and to Tapas for inviting me to speak at your network meeting. It's actually a huge relief to speak to people who understand that this is currently one of the greatest environmental risks to public health that we're facing in the UK. It was Earth Day yesterday, and of course that gave us time to reflect on what is really the fragile relationship that we have with our environment, and of course the devastating effect that air pollution has in the heart of our communities, and particularly on our children. And earlier this week, we once again heard a warning from the coroner in that tragic case of Ella Deborah, reiterating the importance of bringing legal limits of nitrogen dioxide and fine particulate matter down to World Health Organization guidelines. I know we all hope that the government will reintroduce the Environment Bill to Parliament as swiftly as possible in May after the Queen's speech. And of course, I promise that I will continue to press the case along with my colleagues about the importance of those WHO guideline limits on these and many other dangerous pollutants. Because we know that it could prevent up to 64,000 deaths a year and improve the lives of people who are living with a range of respiratory illnesses. So I'll use my contribution this afternoon to set out what I see as the 3 key lessons the COVID pandemic has brought us for air pollution policy, and highlight the recommendations in the latest report on the issue from the EFRA Select Committee, which I'm pleased that I sit on. So first, the impact of air pollution on public health. The pandemic has put a spotlight back on the benefits of less traffic, quieter roads. Let me put it another way. Going back after COVID and carrying on with traffic levels as they were before will simply cause another public health crisis. We cannot do that. Lockdowns in the first half of 2020 were a welcome respite in air pollution, and of course they did significantly improve air quality, even if it was only for a short while. But the EFRA report, that's the Environment, Food and Rural Affairs Select Committee report, highlighted that nitrogen dioxide levels were lower everywhere due to reduced traffic, and 1 in 6 people living with a lung condition reported having reduced symptoms during that time, according to the surveys that were conducted by Asthma UK and the British Lung Foundation. Moreover, across the general population, 18% of people found it easier to breathe. But if you were in London, that doubled. That was 36% of people in London found it easier to breathe. Now, you know, it's sad that it takes perhaps the most draconian measures and restrictions on everyday movements that the UK has ever seen to temporarily curb air pollution from traffic and to highlight the health risk of those pollution levels. So it's vital that we move out of the pandemic, that we sustain the momentum that was there. Even in the summer months last year, when lockdown eased, traffic levels were back up to the same by the end of September. Air pollution levels in 39 of 49 cities and large towns surveyed by the Centre for Cities had returned at least to pre-lockdown levels. Whilst for large parts of last year, offices and school closures may mean that exposure decreased in the long term, in the short term. In the long term, it still remains, and that's why the Environment Bill really needs to enshrine the WHO air pollution limits. And it also is why we want the Office of Environmental Protection, the regulator, to have real teeth and enforcement powers to hold public bodies to account for failing to meet those air quality targets. That's really essential for our kids' future. So that's the first. The second is talking about air quality and air pollution as an issue of social justice. And you may think, well, that's an odd combination, but actually it's really important that we understand this. And the inquest into Ella Kissi-Debrah's death served not only to highlight the health risk from air pollution, but also the racial and socioeconomic disparities about who is affected by air pollution. Ella Kissi-Debrah became the first person to have air pollution listed as a cause of death. And in reality, we know that more than 40,000 deaths in the UK are attributable to outdoor air pollution, and more are linked to indoor pollutants. Now, that's an extraordinary high figure, and we really should not be normalizing that. But air pollution isn't affecting everyone equally. The pandemic sought to highlight national health inequalities based on class and race. And the EFRA Select Committee report cites a University of Birmingham study, which was published in July, that found that people from Black and ethnic minority backgrounds who were COVID-19 patients were almost 2.5 times more likely than white patients to be admitted to hospital. And that was attributed to air pollution deprivation and housing quality deprivation. Now, DEFRA's own research found higher concentrations of nitrogen dioxide and PM10 in ethnically diverse neighborhoods, with a 46% of disadvantaged communities experiencing levels of pollution that exceeded the EU limits, compared to only 2% in the wealthiest communities in our country. So this shows it really is an issue not just of public health, but of social inequality. And of course, what is so unjust is that communities who've borne the brunt of the air pollution crisis have actually, on the whole, done the least to contribute to it. They're the ones who tend to live in inner cities, but are less likely to own cars. And the pandemic's forced us to confront that unequal exposure to air pollution. It's exacerbated health inequalities, and we see this in the institutional racism of the planning system. A recent Greenpeace Unearthed study found that waste incinerators in the UK are 3 times more likely to be built in the UK's most deprived communities. While some studies have shown that the increase in particulate matter and other pollutants are negligible from incineration, a study from Italy found that living near incineration leads to higher chances of developing respiratory illness. So again, we have to take this issue seriously as one of social justice as well. And we've got to begin to account for those inequalities when devising policy. So pre-pandemic, London took strong steps to reduce NO2 emissions with the introduction of the ultra-low emission zone, the ULEZ. And following legal challenges from the NGO, Client Earth, and the government was forced to produce updated air quality plans for nitrogen dioxide. That led to emissions reductions in London that were 5 times greater than in the rest of the UK. And the number of schools in London exceeding the limits of nitrogen dioxide reduced by 97%. That was from 455 schools in 2016 to just 14 in 2019. But during the pandemic, other schemes fared less well. Many of the low traffic neighborhoods, particularly in London, have faced fierce opposition, with residents claiming they weren't consulted, and racial and class disparities again coming to the fore. And many accuse councils of pressing ahead with the low traffic neighborhoods, which only seek to divert traffic from usually what is affluent areas to more deprived areas with high levels of social housing and disproportionately high levels of air pollution yet again. So there's the second. It's about inequality and social injustice, and the way in which air pollution is disproportionately affecting the poorest in our society. And the third element is air pollution as a priority for the green recovery and for central government action. The pandemic's made it abundantly clear that the burden for tackling air pollution can't fall entirely on local authorities without clear direction from central government. That's a key recommendation from the EFRA Select Committee report, and it's an issue of resourcing and of governance. Local authorities face a funding gap of £4 billion post-COVID and are hit with short-term funding settlements, making it really difficult for them to plan for delivering services. That's particularly acute for air quality, which demands not short-term, but long-term thinking. And in the EFRA evidence sessions, we heard from air quality experts who told us it was misplaced to make local authorities the primary bodies responsible for delivering air quality standards, when often councils don't have responsibility for roads going through their areas, because the highway authority would have responsibility for major motorways and so on. So we therefore recommend that not only increased funding and ambition to deliver on the 2019 Clear Air Strategy, but also duties for air quality partners to apply to all levels of government and public bodies. Like most environmental issues, reducing air pollution will require joined up thinking between central and local government, between DEFRA and DFT, that's the Department of Transport, public bodies, school leaders, and demands for long-term funding structures to ensure that all of those are able to deliver. That's why our report called for the government's Joint Air Quality Unit to be expanded to MHCLG, that's the Department of Housing and Communities and Local Government, the Department of Health and Social Care, the Department of Business and Energy, and the Treasury and Cabinet. So not just to leave this, under the control of DEFRA or the Department of Transport, but actually to get all these government departments engaged on it. One of the adverse effects of the pandemic, and where strong government action really is needed, is on clean air zones. Green Alliance research shown that the considerable positive impact of those CAZs, those clean air zones, for delivering not only lower levels of emission, as exemplified within London's declining NO2 pollution, but also actually bringing economic benefits with it. In Manchester, planned CAZs could deliver £40 million in health and environmental benefits by 2030. But a dangerous myth has emerged that CAZs are no longer necessary because of the positive impact of lockdowns on air quality. And a number of the planned CAZs were actually postponed. That was the case in Bath and in Greater Manchester. And that's been blamed on a lack of action from central government, failing to deliver digital tracking systems, which councils will rely on to implement the charging in those zones, as the EFRA report highlights. So the government's Clean Air Fund needs tripling, we said, from the current 660 million, if we're to see air pollution levels fall to safe levels. The recent budget didn't, disappointingly, I'm afraid, secure that, though it did send strong market signals on electric vehicles, and of course that was welcome. And additionally, as our report highlighted, temporary measures to improve air quality around schools by introducing school streets, closing streets to vehicles at the beginning and the end of the day, should be continued after the pandemic. The EFRA report also recommends local authorities introduce measures to limit parking and to reduce idling to clear up the air around our schools. Now, to achieve all of this, we need the direction, long-term target setting, and we need the funding allocation from the top if we expect action to take place at the local level. And Philip Barlow's report into Ella Kissi-Debra's death rightly called for a much greater awareness raising campaign from government on both the health risks of air pollution and more readily available information for monitoring our air pollution levels. That's why the EFRA report advocated for an effective monitoring system, particularly around schools, to identify all those exceedances of air pollution, together with more readily available data and public awareness campaigns. Because, at the end of it all, we have to ensure that tragic deaths like Ella's just don't happen again. And I know that's what TAPAS is working towards. And I assure you, many of us in Parliament are working to the same end. So thank you for all that you're doing. And thank you for inviting me along to be with you today and present some of the findings from our select committee.
Thank you very much, Barry. That was very informative and helpful. Are you able to stay for a few questions?
I have a grandson in the car. We took him out to the zoo today at Whitsnade, who's getting rather hot and bothered, but very quickly, yes.
Okay, so
I have a couple of questions, I'm sure.
I have one here. So can the potential saving on NHS budgets that would be saved by improving air quality be used to justify expense by the other departments? Or is this limited by Treasury rules?
Well, look, does it justify it? Of course it does. You're absolutely right. The cost, not just in treating people with lung disease, heart disease, is not the only aspect here. It's also the days lost to work, the lost productivity, which is lost money into the exchequer. But I'm afraid you're right. The government has always applied these Treasury rules so that you can't say, well, if you spend money here, you'll save it elsewhere. And this is the tragically blinkered way of thinking that so often happens in government. And that's what we need to challenge.
Thank you. Well, thank you very much. I think you better